Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Dr. Sudeepthi Prasad. Dr. Prasad graduated from Bangalore Medical College in Bangalore, India. She worked as a research study coordinator at Stanford University Medical Center. She completed an internship in family medicine at the University of Nevada School of Medicine in Las Vegas. This experience helped her decide on obstetrics and gynecology as her specialty, and she went on to complete her residency in obstetrics and gynecology. Dr. Prasad is affiliated with the American College of Obstetrics and Gynecologists and the American Academy of Gynecologic Laparoscopists.
Well, thank you all for coming today. Let's make this a little informal. I know I'm not going to, like weight management, nutrition. I'm sure all of you have tried once, at least once in a lifetime, to lose weight. And why did you think you started initially? Either advice from your doctor, or your clothes were not fitting, or you had diabetes, hypertension, you wanted to cut your medications down, or you had a baby, you wanted to lose extra weight. So those are the most common things. When the lady was interviewing for me for the Tri-City, she was asking me, you're an OBGYN, oh, why are you giving the talk on weight loss? Because I'm telling my patients every single day to lose weight, every single patient I see. And then we went on to talk about infertility and the whole thing. We'll talk more about it. Often you hear, like if you go to parties, I'm like, oh, I'm dieting. Diet is nothing but your food consumed. When you say you're dieting, it's just you select the nutritious food just to control what you eat. That's all it is, no matter what you eat. So why do you gain weight? This is a $1 million question. So there are a lot of theories. One of them is calories in, calories out. So you either eat too much or decrease physical activity. But there are other theories which actually disprove this, which is not just calories in and calories out. The most recent theory is about sugar and carbohydrates. So like the most simple sugars are the ones in fruits. The complex ones are your rice, potatoes, wheat, all those are your complex sugars. They indirectly lead to insulin resistance. That's the bottom line. So your body cannot utilize the sugar anymore. The more carbs you eat, the more it's put away as fat. So this is like an hour talk by itself. So the bottom line is you need to know sugar and carbs are the most important thing to lose weight. That's the thing. But even for your, to control your cholesterol, to control get off your blood pressure medications, to control your diabetes. Obviously, if you're a diabetic patient, if you go just on high protein and low carbs, you could go into ketosis. So you always want to check with your doctor to be in the right amount of diet. So following my talk, Anna Maze is going to give you a good diet talk about that. So obviously, if you're a diabetic, you do want to visit your dietitian and be on a well-balanced diet of carbohydrates, protein, and fat, which is like 50, 30, and 20. That's your ratio. That's the normal intake. And I'm sure all of you have heard, if you fill your plate, make sure half of it is veggies and the other quarter part of it is protein and the other one is fat. So that's how you divide your plate into. So another interesting thing is, well, we'll come to it. These are the books which I thought were really good. Why We Get Fat is an awesome book. I just put it here just because it's relevant to why we gain weight. Good calories and bad calories. Actually, I'm attending his talk next month. Has anyone watched Fathead? It's a documentary. Has anyone watched Super Size Me? Yeah? Okay. So you should watch Fathead. It's kind of like a sequel to the Super Size Me. You know how you eat fries and then he gains like 30 pounds, and then the Fathead is nothing is related to anything. Like you could still eat what you want and still maintain your weight kind of thing. It talks about all the theories, and Gary Taubes actually appears in that documentary. So it's a nice one to watch if you want to. Health effects of obesity. So I'm sure all of you have heard about it a million times. Heart disease, #1 killer, diabetes, cancers. So all of you know that you do need routine screening even if you're very healthy, because you never know when you can pick up diabetes. You don't want to be one of those persons who would end up in the emergency room with blood sugar of 600 and then, oh, you've been diabetic for the last 10 years, by the way. So you don't want to hear that, which is why you do your routine screening. You go to your gynecologist to make sure you have screening tests for cervical cancer, make sure you screening test for breast cancer, you have your routine colonoscopies, you go to your GI physician, that is when you turn 50. They have your routine mammograms. So cancers, endometrial and breast cancer and colon cancer. So endometrial cancer, so it's the cancer of the uterus. Endometrium is nothing but the lining of the uterus. So how does your diet indirectly affect that? The more carbs you eat, the more fat you eat, it's converted into fat in your body. So your body is going to utilize only what it needs. It's going to put away the rest as fat. The fat actually stores estrogen, and there are some receptors which convert some hormones into estrogen in your body. That indirectly thickens the lining of the uterus, and you're more prone to endometrial cancer. And higher your BMI, which is a body mass index, which we'll come to in a second, higher your BMI if you're in the obese range, increased risk for uterine cancer. And breast cancer and colon cancer too. You'll notice that someone with a BMI of 30 and above, who's like 300, 350, 400 pounds, it's hard to feel any masses. And we start screening only at age 40. But there's still that 30 to 40 where we don't do routine screenings because we don't find that many breast cancers, but it's rare. What if you're one of those? It just helps you like feel the breast more thoroughly without the fat, because breast is made of all fat. Hypertension, which is high blood pressure and high cholesterol levels. I don't need to tell you the stroke. Liver disease, which is accumulation of fat in the liver. And gallbladder disease, gallstones. Sleep apnea, respiratory problems. Sleep apnea is most overweight women, men usually notice it, but it's never picked up. I'm sure I don't know if you have partners, you've seen anyone snore, they kind of like stop for a second and then go back. That's sleep apnea. So there's decreased oxygen just for that few seconds. And if that happens more and more and more often, then there's decreased oxygenation. Okay? You might want to get that checked out, anyone in your family, if you notice anyone. So snoring is something definitely to be looked at. Osteoarthritis, self-explanatory, it's a degeneration of the cartilage. It just happens with age. Gynecologic problems. Many of you might wonder, how does obesity lead to infertility? It does, and it happens all the time. And I see it day after day after day. If you've heard about PCOS, which is polycystic ovarian syndrome, which is decreased ovulation from your ovaries. So if there's no ovulation, you can't get pregnant. So you have about 5 to 6 periods per year. So if any of you notice it, if any of your friends know it, definitely go to your gynecologist just to make sure that everything is okay. You do need estrogen for your bones. So it does indirectly lead to infertility. And even just 10-pound weight loss could help you ovulate and get pregnant. Okay, so we're just talking about the body mass index. It's kind of a crude way to assess your weight, so where do you go from here? So you thought, okay, I just heard this talk, I want to lose weight, what do I do? So the first thing to do is assess your weight. So what's your body mass index? It's nothing but height over weight whole squared that kind of gives you a number. So anywhere from 18 to 25 is your normal weight. 25 and above to 29.9 is overweight, and 30 and above is obesity. It's not the best way. There are people who have a BMI of 27 and still look very healthy for their height and weight, but it does increase your health risk. because it doesn't give you body fat. And you can't say a person with a BMI of 27 is not healthy. Waist circumference. That's the other thing which has a direct relation to your heart disease. So you take a tape measure, feel your hip bones, and then directly measure right above, go all the way around, and then measure in inches. Women with 35 and above and men with greater than 40 inches have increased risk for diabetes, high cholesterol, high blood pressure, and heart disease. How do we know? They took a group of individuals, going back to the other slide, and then they saw men with 40 and above, women with 35 inches and above. That's direct relation to the abdominal fat. Losing weight, like you know, it's not about just losing weight for a wedding. It's not about losing weight for a party. It's about your lifestyle. It's about what you do every single day. It's long-term changes, whatever you want to do. I mean, whatever little changes you want to make, like drinking lots of water, will come to the subsequent slides. So what's a normal weight loss? Anywhere from 1 to 2 pounds per week. So you don't want to lose 10 pounds in 10 days. I'm sure like anyone who wants to lose weight have gone online, looked at all the weight loss programs, and have tried to do something drastic or bulk cleansing. Not the healthy way to do it. So the best way to do is long-term changes. And you can do it gradually. The old habits die hard. Nothing is going to happen overnight. And you didn't put on weight overnight, so you're not going to lose it overnight. So it's going to take a while. We talked about calories in, calories out. That is one theory. Doesn't mean that that is the only one. A lot of scientists have disproved that. And there's this crude way of 1 pound equals 3,500 calories. If you need to reduce your weight, you decrease 500 to 1,000 calories per day to lose about 1 to 2 pounds per week, which all that it means is probably cut your soda. So that's all probably it means. I'll probably cut down your 6 pieces of chocolate to 2. So that's all it is. Like you put on weight over a period of time. So when you're baking, you could do like half Splenda and half sugar. So the taste is not like really, really different. So you can definitely try that. I tried that in my apple pie. Turned out great. We talked about the simple carbs and the complex carbs. The basic sugars are the ones you get from glucose and fructose. Your body can use it very easily. And also you get hungry faster. Just the whole theory is you eat sugars, you have an increased spike in your sugar level, and then you're hungry again. So the more sugars you eat, the more you eat, the more overall calories you eat. And we talked about complex carbs. Last but not the least, the corn, which high fructose corn syrup, all of you have heard about it. Okay, so modest weight loss. What is a modest weight loss? If you're 180 pounds, 10% is about 18 pounds, 5% is about 9 pounds. So even if you lose about 9 pounds, that's great. I mean, always have small goals. I know that all of us think, oh, I have to lose about 40 pounds. Yes, we might have to lose about 40 pounds, but the most important thing is for you to set small goals so that you can reach them. If you're 180, so make sure 9 or 10 pounds is your first weight goal so that you can get down to 170 first before you go to 150, if that's where you want to go. Okay, these are different steps. Make a commitment. So do all of you think weight loss needs commitment? Yes? Okay, glad we agree on that. Take stock of where you are. So your weight assessment, what's the ideal weight for your height? You might, I mean, if you look at the BMI chart, they say for me the ideal weight is between 125 pounds. I weigh 160, and I'm very happy with it. I don't want to go in the BMI chart and weigh 130. I know that I've tried that once and I looked very anemic and everyone thought something was wrong with me. They're like, are you not eating your food? Are you sick? So the good thing is for you to lose weight, look healthy. Set your realistic goals. We just talked about it, 5 to 10% weight loss, and then you can go from there. sources of information and support. Sometimes all the time the doctors have is to say lose weight. That is a start. Say, okay, your blood pressure, high blood pressure, and your diabetes are out of control, or you have PCOS, weight loss helps. So sometimes you need more backup for that. So if I go and tell my patient, oh, you have PCOS, you need to lose weight, obviously some patients obviously are very good at asking questions, and some patients are not. So you need to hear from your doctor. So make sure when you go to your physician, ask questions. Everyone, before they leave the room, will say, do you have any questions? So make sure you make a list if you're going for your annual exam, if you have any questions, concerns, or if you don't have any, then based on what your physician talks, you can go from there. So if they say, I need you to lose weight, so you have PCOS, why do you want me to lose weight? So, well, why is not a question just because your doctor already told you 20 pounds overweight. So the most important thing is to let them know your 10% weight loss will help you get pregnant, and you'll ovulate, and there's an indirect effect of insulin resistance on your system. So just the basic 2 or 3 sentences will help them great. So most of the patients I've explained have lost some weight. I haven't seen them gain weight. And obviously continue to check in with yourself to monitor your progress, to see what you weighed last week, what you weighed this week. There are a lot of weight loss programs and which do teach your healthy lifestyle, like Weight Watchers. Yes, you do have to pay like $11 per week. So some are expensive, some are not, but you don't have to spend money to lose weight. So you can definitely attend or go to a dietitian if you don't absolutely know anything about anything. So there's a start somewhere. So start your research. There's always Google, or Bing. Highlight the habits on your list, which is most common ones. Are you eating too fast? You always want to finish everything on your plate. Are you eating when you're not hungry, when you're stressed? Is it stress eating? The only way you're going to get all these out of your food diary. So people who have actually kept a food diary have lost a lot more weight than people who do not document anything they eat. And be honest with yourself. It's for you. It's not for anyone else. So even if someone else is looking at your diary, they can actually give you honest feedback if they look at what you're doing. And eating while standing up, eating in front of TV, always eating your dessert. You can always eat your dessert, but just stop at 1 or 2 spoons. Skipping meals. Definitely do not skip your breakfast. If any of you in this audience are skipping breakfast, please do not do that, because your body is in a fasting state for almost 8 to 12 hours. And if you miss your breakfast, then whatever you eat, number one, it leads to overeating the later part of the day. And number 2, the body is going to put away whatever you eat as fat, thinking that you're not going to give it food for a while. List of cues, we just talked about it, to identify your triggers. Common triggers, all of us have been here, including me. Opening up the cabinet, seeing your favorite snack food. So it's good to start at home if you have high-fat food. If you love donuts, just go to the store and eat one. Don't bring home a dozen. Sitting at home watching TV before or after a stressful meeting or situation at work. So when I get snacks to work, I always bring the healthy ones so that I can snack on them along with my staff. Coming home after work, have no idea what's for dinner, so plan ahead. Know what you're going to eat tomorrow. Know what's for dinner, definitely. That's the, I think for me at least, that's the most important thing, and also for many others I talk to, because you don't know, you're really hungry at that 4 or 5 p.m. when you're driving back home, or either you eat a lot when you're driving back home from the car, have a snack, or just have something healthy, and know what you're going to have for dinner. Yeah, this is the most common thing. If you go to someone's place, it's like, oh, I've made this dish just for you, and if you don't touch it, and they're like offended. It's okay to eat some and compliment them the first spoon you eat. You don't have to like eat the whole dish they gave you. These are, again, the most common triggers. Drive-through. Okay, so reinforce your new habits. Work on one thing at a time. Like 1 week and just on water intake. Water is your cheapest medication. It flushes out toxins, keep your kidneys healthy. 70 to 75% of your body is made of fluids, so it keeps your body fluids healthy, the ECF, and I don't want to go into the medical terms. So it just keeps you healthy overall. What I tell my pregnant patient is everyone I see in the first 12 weeks, most of them have nausea, vomiting. So all that they need to do is drink sips of water all through the day to keep themselves healthy, to prevent visit to the ER where they have to wait for 4 hours. And then they're going to put an IV line on you, which you could have totally avoided. And then you'll get a bill for about $6,000. So the same thing, anyone else, like avoid getting dehydrated, drink lots of water, prevents kidney stones, a lot of health benefits just with water. Focus on one change every week, we talked about it. One thing I want you to concentrate on is increase protein in your diet. If you're a vegetarian, more so. If you're a meat eater, definitely. Another documentary which is very interesting to watch is called Forks Over Knives. It's very interesting because all that they concentrate on is animal protein, like being a vegetarian and also eating meat products and your dairy. So the whole thing, the reason I watched the documentary was because I watched 60 Minutes, and they were talking about animal protein causing liver cancer and all the different kinds of cancers, just because your body has to digest a different kind of protein, and how Bill Clinton, after he had his bypass, went on just no animal protein whatsoever. Apparently the most ideal diet to be on. I don't know how many of us would love to be on that diet if you want to like give up your meat and your dairy products, and which is not ideal. I mean, I can't go to a store and actually buy nut cheeses. If any of you didn't know that, they make cheeses out of nuts. And the only store it's available is in San Francisco. So I can get it in any store I want. If I want to give up my animal protein, I can get my protein if I'm a vegetarian. So it's partly our society too, but I'm sure it's changing. So what's your diet? Number one thing, be active. Be active does not mean always going to the gym. It could be a million things, like to start off your day, take your stairs in the morning. Even if you work on 6th floor, I mean, when I was in Vegas, there was a tertiary care center. That's where I did my residency. I was not in the Strip, which is only 4 miles. So we were on the 7th floor, so I would take my stairs every day. Yeah, I was out of breath, but I knew that I had to get my heart rate up. Stay on course, so always check back where you started, where you're going. It does need a lot of commitment, but once that becomes a lifestyle, it's easy. Like when I talk to my patients, I start off with, so what do you do for work? How many kids do you have? What time do you wake up? And when do you drop them off to school? So just helping them to fit in your physical activity there. They're like, oh, I wake up at 5, I can't absolutely go. And then like, what time are you back? Can you fit in your lunchtime? Can you do like 30 minutes of walk? Consistency is the key for your physical activity. So you don't want to go to the gym or walk or do anything like once in a while. So often I have patients I ask my patients routinely who come in for your annual exam, so what do you do to stay active? Some patients who routinely do things, they say, oh, I go to the gym, I do treadmill, I walk 30 minutes 3 times a week. Or patients who say, yeah, possibly treadmill. So when was the last time you did anything? 2 months ago. So consistency is the key. Okay. Follow a healthy, realistic eating pattern. So if you see a dietitian, or if you see a physician, some physicians, primary care physicians, some gynecologists do follow up your diet, like healthy, realistic eating pattern. So if you want to tweak your diet around what you eat, then you have to keep your food diary, make sure someone takes a look at it, and then probably adjust it according to whatever kind of food you eat. Indian, Chinese, Vietnamese, whatever cultural food you eat. Keep your eating patterns consistent. So I'm sure all of you have heard about eating about 5 times per day to keep your metabolism up so that your body doesn't go to sleep. Make sure you eat every 3 hours. Eat your breakfast every day. Stay active, we talked about that. Stay on course, monitor your diet and activities, see what you're doing. It's definitely important to keep your food diary so that you can write what you're working out, and then you can look back and see, oh, let me see what have I done in the last week or two. Monitor your weight. Get support from your family and friends. If you're trying to lose weight, it's okay to tell people that I'm watching my diet, I put on a lot of weight, I'm like excessively tired, I just want to lose some weight. And you can still taste the food or anything they make, but not overeat. Portion size. The most important thing is when you go home, and depending on what kind of cups you have in your cabinet, if you pick up the biggest cup you have in your cabinet, you're bound to fill it up. So if you pick a cup for your cereal in the morning, make sure you pick up the smallest one, because every food or everything we eat has portion sizes on it. So start reading labels. So when you go shopping, you don't have to go with your spouses because they won't let you read labels. Make sure you read the labels, make sure you know what's in it. The best kind of food is which has the best fiber content in it. So cereals which have 9-10 grams of fiber are healthier than 2 grams of fiber. If you don't look at anything, if you just look at the fiber content in your food, so if that's higher, definitely healthier food. Prevents colon cancer. So I tell my patients to eat fruits rather than making juice out of it, like orange juice. Like you squeeze juices out of 6 oranges and throw away all the fiber you actually need for your body. So I would rather you eat 2 oranges or sit and eat 4 oranges, that's fine. You're going to get all the sugar and the fiber you need, because you can't eat 4 oranges because it fills you with fiber. Okay. I thought this was funny. Well, this was fun. Thank you.
Thank you, Dr. Prasad.
You're welcome.